welcome once again to the Sage. Thank you for being with us, and what a journey it has been. For those of you who were with us for the past 2 weeks, we had discussed the issue of Black Africans in the diaspora. We had dwelt a great deal on the UN decade for people of African descent. We had talked to amazing young doctors, women doctors, who reside in Canada and who had shared their own take on the health of young people. Today, I am so pleased to say that I was able to bring one of them back on set again, this time to share more in detail about her work, her life, her career. Dr. Ifeoma Achebe is a public health and preventive medicine specialist based in Alberta, Canada. She obtained her medical degree in 1996 from the Nnamdi Azikiwe University Teaching Hospital, Nigeria, and proceeded to the London School of Hygiene and Tropical Medicine of University of London, where she obtained the PG diploma in infectious diseases and a master's degree in epidemiology in 2002. She moved to Canada in 2004, where she completed a residency program with the University of Alberta in public health and preventive medicine. She is also a fellow of the American College of Preventive Medicine. Dr. Achebe currently works as the lead medical officer of health in the central zone of the Alberta Health Services, which is the largest employer of labor in the province of Alberta. She also holds a clinical lecturer position at the University of Alberta School of Public Health. She has many interests. She's a mother of 3 beautiful children. She's worked for many years in Canada. She has a lot to share, to inspire many of us. Ifeoma, once again, welcome to the Sage.
Thank you very much. My pleasure. My interest in medicine started when I was in high school. I used to do a lot of sports, and I actually got an injury once, and my mom took me to the hospital, and I met a doctor who treated me so well, and then from then on I said, I want to be like him when I grow old. And my parents said, okay, fine, if you want to be like him, then try and do well in your sciences. And so I started putting more efforts there, and luckily for me I was able to get in Nnamdi Azikiwe, finished my medical school there, and then while there I met Dr. Ogbuagu, who happens to be my teacher. So that's the confession. And was a lecturer for community medicine in those days, and we admired her a lot. I personally admired her a lot and wanted to be like her when I grow up. So she actually made me very interested in public health. And I remember one project that we did in Neni. Then I'm not sure if you still remember that, but we went there. It was community diagnosis in Neni, and we went there, did some interviews and surveys of people there, and women and children, and found out what their health needs were, and we reported back to you. So that was really neat for me then. I'm
Wow.
Like, what a way to impact a population. And so I started thinking about it, and when I finished, I did my internship at UPTH in Port Harcourt, and got married. Following that, we moved out, and I got this opportunity to do this at the London School. That was my first leg into anything public health related. So I did my postgraduate diploma in infectious disease, which was part of my epidemiology master's program. And so, following that, I moved, of course, I had kids along the way, and came over to Canada. being a foreign trained physician in Canada, I had to go through a series of exams in order to get into residency. I was still very much interested in my public health. I took the exams, passed them, and then I got into University of Alberta um, School of Public Health and did my residency there. Finished, and then started work with AHS. I've been with AHS since I finished in 2010.
AHS is
Alberta Health Services. Yes. So I've been there since 2010 when I finished residency, and initially as a medical officer of health, but later on I moved to the lead. So I have a team of physicians and other staff that work for me in that zone.
Welcome back to The Sage, and thank you for being with us. If you were with us last week, you will remember the amazing and very interesting discussion we had with our young, lovely, talented guest, Dr. Ifeoma Achebe, one of the brilliant young Nigerians in the Canadian diaspora, who has spent well over 15 years here in Canada practicing as a specialist in public health. Ifeoma told us how she got there. She described her very, very interesting public health job and career here in Canada. Ifeoma, once again, thank you for being on set. Welcome back to the show.
Thank you.
It
was a pleasure.
Yeah, as we task you even more, you've described a very busy schedule. Very absorbing, very interesting. But I also do know that you managed somehow to execute it with you combine it with raising 3 lovely, amazing children. Tell us, how do you do it? What is life like being a mother and a specialist physician with a busy job?
Well, it's not easy at all. It's like having 2 full-time jobs. But you know what?
Tell me about it.
With a positive spirit, you always excel. So I have 3 kids, and at the time I was going through my training, my kids were still very young, and it was really tough. But it was a question of having a supportive partner, my husband, who was always there and supportive, and then being able to make sure that all roles are covered. Roles were covered. I had a help. I because it wasn't easy. Sometimes I'll do hospital calls and stay overnight in the hospital as part of my residency training. And so during those days were the toughest, because sometimes I won't even see my kids for 2 days, 3 nights, but then because of the way this place is, it was just a question of planning with the little help that I had then, who was a nanny that was coming in to help and take care of the kids. We'll get them ready. They'll get them ready for school. Thank goodness things are a bit more efficient here. The school buses are running, and they would take them to the school bus. And one thing I did for sure was every house I got was on the route of the school bus. So okay. my house, I always bought houses, or always had bought houses that were just 1 or 2 steps away from the bus stop.
I know that trick where when you're thinking of moving,
right?
You check where is the school,
yeah,
where is the bus route.
Exactly. Yes, and so that made it very easy, so that when the kids get back, they can open the door and get in, and and then in the morning too, when they are ready to go to school, they can walk out and run to the school bus and the bus stop and wait for the bus. So that made it easy, and it made it easier. It was never easy. And then of course, as a resident, you have your days off, right? So on those days off, I took good advantage of it. I would prepare meals for the week, make lunches for the kids for the week, um, and then well, try to pack them and instruct. Of course, we had a menu because I wasn't always at home, and there's only so much that the dad can do, right? So I try to make sure that the food aspect of it and other things were taken care of in my absence. And with time, my oldest one uh, became 11 or 12 years of age, and she took the Red Cross babysitting course. And so she was now able to.
That was to equip her, eh?
Yes. And then she was legally able to look after the younger ones. So she was. It was really helpful having her, do those courses. And of course, you have to have some ability to plan ahead. I know that it wasn't easy at all. Sometimes I would have to be on call and be in hospital for 2 nights, 3 nights without seeing my kids.
Wow.
Yeah.
Wow.
So, but I know that it wasn't something that was going to last forever. It was just a phase, and so I stuck to it. With the support of my loved ones around me, and I was able to succeed.
Yeah, really. That's amazing. It's good to know that. What were some of the strategies you used? How did you make it happen?
Well, one thing that I did, here, my kids were in this, in elementary school and not kindergarten at that time. So, first of all, the house I would live in would have to be on the bus route for school kids.
Yeah.
So, I know 2 houses that I lived in during that time. I made sure that the bus route was just in front, so my kids would jump out of the house and run into their bus and go to school and come back the same way as well. So that made it really, really easy.
That's what I call being a clever mom.
Right. Right. And then the way it is here, really nobody cares whether you have a family or not. So you just have to think ahead, plan ahead. Weekends when I have my off days, I spend that time cooking, packing lunches for the week for everyone, and making sure that they are good to go to school for the upcoming week. And so that took a lot. And then plus that, I'll have to make out time to study. Because as you're going to residency, you're being tested and, evaluated so that you can move on to the next stage. So I needed to be on top of things too on the other end.
Yeah.
So it wasn't easy juggling those two, but it's doable. The young people out there, don't even, think, when you have a goal, don't even think about anything else than to, work towards that goal. You get comments from people, sometimes even your friends, trying to discourage you. Oh, why are you doing that? Your kids are too young to be left at home. Don't do that, it's not good, blah blah. Just keep focused on your goal. The end point is where your eyes should be. There is nothing that is not achievable with hard work. When you think about people like me that have put in that hard work and achieved success, then that should be a motivation to you.
That is such an important comment, and you struck a note that went back, in time for me. Yes, I was your teacher. Yes. It's many years ago, but it was still many times the same tension, and sometimes even more severe in that time.
Right.
Because I remember that at a point, as a busy young doctor and mother, as I had to be away from home, either on call or even to attend conferences and meetings, people would, make me feel guilty.
Right.
Until one day I had a professor, very kind, who said to me, and I shared my concerns, and who said, it's not the quantity of time that is important.
Right.
What is really important is the quality of the time you have for them.
Right. And my own kids now see me as a role model, and they are older now. They are in their teenage ages and young adulthood, but they come to me and say, "Oh,
Mom, I can't believe you did all this with us, when we were that young. Oh my goodness, I have to do even more, And so my daughter
And they
is
will
in
say,
med
Mom, how
school.
did you manage it?
Yeah, yeah.
So it's
So
an
it's
inspiration.
an inspiration for my kids for sure. They say, "Oh, I don't want to be a stay-home mom at any time, or have a stay-home wife for my son." And so they say, "Oh, everyone has to work hard, and achieve your dreams." My mom did it with 3 kids, and I don't see why I shouldn't be able to do it.
How old are they now?
So my oldest is 24.
Wow.
Yes, the second one is 22.
You make me feel old.
Right, I started early, and then my youngest is 19. Yeah.
Okay.
Yeah.
Amazing.
Yeah.
Foma, thank you so much for sharing with us. But I'm going to take you up once more and ask you to think about the future. You're young, you've done so much in your career, but there's still so much to do because, life goes on.
Mm-hmm.
So I'm going to ask you to do two things really. One is, what are your plans for yourself, your career, for the years that are coming? And also, what do you say to many other young Nigerians there? What would be your word of inspiration and encouragement to them?
Right.
Yeah.
So, where I see myself in the next few years in my career, I really want to be in a leadership position. I'm a physician, accomplished physician. I've done clinical practice for some years. Now combining a clinical role versus a leadership role on a smaller scale. I'm leading a zone in Better Health Services for public health, so zone lead MOH. That's my position there. But I want to go to the next level of that leadership. Being able to uh, um, be part of that voice, executive leadership table at the entire organization. And I want to be there, not just for myself, but for other people, upcoming,
Absolutely.
immigrants and people of color coming after me that are still in doubt as to whether
Can they make it?
they can make it. Yeah, so I believe so much in mentoring and role modeling, and so I that's my next target in terms of my career. Yeah.
I love that. I love that. I am particularly touched because I do think mentoring is so important. It affects people's lives so much, beneficially so much.
Right.
And so I laud you for that. I've always said that if you live out your career, your life, and as the ends come for many of us who are getting old, if you look back and can see many who have been inspired and following in your footsteps,
Right.
then you haven't really succeeded.
Right.
What do you think?
Yeah, when I came here, I honestly didn't have enough, people like that looked like me in those positions. So it was hard, but I just had to get into the system, prove myself to get to where I am today. But I really missed that opportunity to have someone like a role model or a mentor, who would carry me along. And so I would like to be able to be in that position to provide that kind of help to upcoming young people coming after me. Yeah.
Wonderful, wonderful. And so I also ask you to turn to our audience, and for the many other young people and Nigerians, particularly in our dear country, Nigeria, what would you say to them?
Well, Nigeria is our country first and foremost, and I love Nigeria. Nigeria is what made me what I am today. That's where I had my medical school. That's where I was born. That's where I was raised. So I'm still very attached to that country. I love that country very dearly. And to all the young people watching me in Nigeria, you can make the best of your situation wherever you are within the country. I know that things are not as good as it was 20 years ago plus when we were in school. But you can still try to make the best. I still get a few calls from, physicians that are just moved, maybe to Canada or elsewhere, just to talk to me. So just try and focus well on what you're doing. Make sure you come out in flying colors. If you're in school, try your best, put in your best. You never know when that certificate or qualification will come in handy, and you apply it. And so the other thing is, you know, you also have to participate in the process. Like a lot of young people think that they don't have a say when it comes to making a choice or choosing who their leader is. Get your PVC. Next year is the election. Get your PVC and vote according to your conscience. Let's try and make Nigeria a better place by having a say in choosing who leads us. Here in Canada, things are working because we have a say. We go to the polls and vote in our leaders based on their track record, and then we take it from there. So the very first and foremost step is to make sure you participate in choosing your leaders, and also try your best in whatever endeavor that you have chosen. Thank you.
Beautifully said. Beautifully said. Thank you so much.
You're welcome.
Thank you for being the inspiration for me as a teacher and mentor for you. Shows I haven't failed everywhere. I have succeeded in a few.
No, you haven't. Yeah, I continue. I'm so glad to be able to come to this program, and you are very instrumental to what I am today. I didn't know anything about public health until you came and taught us that in medical school, and then I developed interest, and here am I today practicing as a public health physician in Canada. So thank you.
Thank you. You give meaning to the work I have been doing all my life. Thank you so much, Dr. Achebe. Thank you. I will say former because you're my own. And so I think we end the 2 wonderful episodes we've had with Dr. Achebe on a wonderful note. Her words of wisdom to her colleagues everywhere here in Canada, but also very importantly for many of us who are still in the home country, Nigeria. Work hard, don't give up. You will get there. Study, get your qualifications. They will come in handy sometime. Don't give up on the task. And I'm also very proud of her because of her sense of responsibility, in which she is thinking about the importance of her mentoring others, so that there will be many who can indeed be like her and be the best they're meant to be on this planet Earth. It's been wonderful. We have listened to our beautiful young person in the Canadian diaspora, Dr. Ifeoma Achebe. She's been an inspiration. And so there will be more. Stay tuned hopefully soon in the future. Before we leave the Canadian continent, we hope we'll bring you discussions and important words of wisdom from our children, from our own young people in the diaspora. Thank you once again for having been a part of The Sage. Do join us next week. And thank you.